Hello friends, today I will talk about H-type hypertension. So hypertension you all must be knowing that is high blood pressure. So anyone who has a blood pressure of say more than 140 by 90 it is hypertension, and those who have more than say 130 by 80 it is high normal. So but what is H-type hypertension? So if a person has elevated plasma homocysteine and along with high blood pressure. So those who have both elevated homocysteine levels in the blood and high blood pressure, that is called H-type hypertension. And why is it important to recognize that whether somebody has H-type hypertension or not? So hypertension, as you know, is an independent and a very important risk factor for causing stroke, which is the commonest cause of paralysis and one of the three leading causes of death and disability other than heart attack and cancer. So those who have elevated homocysteine and high blood pressure, they have a much more higher risk of developing stroke as compared to those who have hypertension without high homocysteine. So put this in the perspective. Let's say if a group of people have normal blood pressure and normal homocysteine, and another group has got high homocysteine and high blood pressure. So this particular group, which is H-type hypertension, they have almost 13 times higher risk of developing stroke as compared to if both BP and homocysteine levels are normal. And not only the risk of stroke increases, but also the risk of stroke related death, that also is about 12 times higher if both were normal. So in the end, I want to convey an important message, and that is blood pressure we all must check routinely. At the same time, we should also check homocysteine levels in the blood, and if it is checked once in a year, that is sufficient. And there are certain groups of people who are more at risk of developing high homocysteine. Among them, one is those who have vitamin B12 deficiency, and second, those who are smokers. So these two groups have a higher risk of developing high homocysteine, and once it is diagnosed, it is very easy to treat. So BP should be controlled, kept below 130 by 80. Homocysteine should be kept normal. Best is to keep it below 10 or at least below 15. Then with these two measures along with the other measures, we can definitely reduce the risk of developing stroke.